Hey, what's up? This is Carl from healthcodeacademy.com, and today we're going to talk about blood clots because blood clots suck, and I actually got one last week for the first time, so you can see my bands here. Alright, this will be my shorter of the two videos. I'm going to make one more for prevention for people that haven't had a blood clot, and I'm going to make another video. I'll post the link that is centering around what people do once they've had a blood clot. So let's get to the prevention, because it can happen to anybody. Like, I'm 6'4", 210 pounds, in super good shape, but runs in the family. I've got varicose veins, and we'll get into all this, but I'm at a higher percentage of getting a blood clot because everyone in my family, except for my oldest brother, 7 people in my family, have had blood clots. So sucks. I've got those varicose veins. Anyway, how I got my blood clot personally was I flew back to Los Angeles on the 30th of December 2014, and I didn't do a lot of things I should have done. I never thought this would happen to me, but it did. So I don't want this to happen to other people. If I can help one person not get a blood clot, this is well worth it. So here's the list. First off, common sense, didn't really do it, but every half an hour to 1 hour, if you're on an airplane, you're packed like a sardine, especially if you're tall like me, and it's not good blood flow for your legs. Every half an hour to an hour, get up, walk up and down the aisle. Chances are, as long as the seatbelt light isn't on, they'll be cool with it. If anyone questions you, that being flight hostess, whatever, just tell them I'm at an increased risk, and it says we can walk around, so I'm just going to walk, back and forth once or twice every half an hour to an hour. They shouldn't have a problem with it. It should be all good, because I have family members that do this. It shouldn't be a problem. Number 2, very important, you're at a higher risk of blood clot if you are dehydrated. You're on an airplane, you're probably dehydrated. I sure am. So one thing that I'm going to be doing, aside from drinking water, it's pretty hard to stay hydrated on an airplane because they give you these dinky little cups, and of course it's a pain to bring water because with all these TSA flight regulations. So what I'm going to be doing is I'll have a big container of water. It'll be empty though, and I'll just fill it up once I get past security on TSA. I'll find a water fountain, fill it up, nice big container of water, and I will drink that through the flight, and that will keep me hydrated much better than little tiny cups that I am given by the airline hostesses. Alright, next, something that I should have used, because I actually had surgery on my leg to remove, basically we didn't know at the time, but a blown valve behind my kneecap here that came in behind here. But they took out some vein, soldered some veins shut, and I'm sure, and that's the leg I got the clot in. Definitely put me at a higher risk, even though I already was, but they gave me compression stockings back then. I really don't use them. However, if you fly a lot, you have varicose veins, and you fly, definitely talk to your doctor. Compression stockings. They actually, for women, they actually make like stylish ones now, so you can wear them and look good. And for guys, we wear pants, so no one will know. If you're self-conscious about it, you'll look sillier wearing like a hospital robe with, your butt showing. So trust me, just compression stockings. They work. They keep, everything constricted, and your blood will be flowing in the right direction. And it's just a great thing to do. The only person in my family who has not had a blood clot is my oldest brother. He's a microsurgeon. He wears compression stockings all the time because he's on his legs doing surgeries. So there's no doubt in my mind, they work very well. They're kind of a pain to get on your legs, but just do it, Alright, next. A lot of people that are wise anyway, they'll take a baby aspirin before flying. Definitely advise this. If I get off blood thinners, I will definitely be doing this. Some people take a regular aspirin, some take a baby aspirin. Talk to your doctor about which he or she would advise you take. But it's definitely good, you want to thin your blood a little bit before flying. And last but not least, if you're at a high risk for a blood clot, or you've had a blood clot. I didn't know about this. I was talking to somebody and she had a blood clot. She's 30 years old, in great shape as well. And whenever she flies, she will take a shot of Lovenox, which is a blood thinner, which I had my last Lovenox shot today. I totally can't give them to myself. You basically go in your bottom belly, give yourself a shot. For me, it hurts like hell. It's supposed to work, I've been told, for 24 hours. I'm going to see a hematologist and I'll find out about that. But it's an option, and if you're at high risk, talk to your doctor about it, see if he or she thinks that's a good idea. Because if you're at a high risk, you know, taking a blood thinner could be definitely the difference between, you know, getting a blood clot, not getting a blood clot. You know, you just have to take it before flying. If you're like me, if this is an option for me, I'm definitely just gonna hit up the doctor's office, you know, the day I fly, get a shot, or hopefully I'll, you know, meet a nice girl, get married, and she can give me the shot while I cringe in pain. And then she'll give me ice cream afterwards, because I'm wimpy like that. But prevention, okay, this is just general prevention. I'll go through it pretty quickly. Walk about 30 minutes every day. You know, you'll get your blood flow going. You'll be keeping your muscles nice and strong. It's good for your vascular activity. And of course, vascular equates to veins. Number two, try to have your proper height-weight proportionate. You know, don't be too overweight. Definitely don't be obese, because you're at a heightened risk of a blood clot, amongst other things, of course, if you are, you know, overweight, out of shape. Number three, not only, you know, related to, you know, sitting on an airplane, you know, packed like sardines, you know, and not getting up. If you do, you know, work on, you know, if you do a lot of reading, or you do work in bed, you know, you're laying in bed, definitely move your legs around, get up, you know, every, you know, half an hour to an hour, move around, go to the kitchen, get some water, stay hydrated. And, you know, a lot of people like to do work in bed, but you can get a blood clot that way as well, especially if you're older. Next, stop smoking. If you smoke, you're at a heightened risk, definitely. I mean, it's hard to quit smoking, but there's a lot of programs out there, and you'll be healthier, and your risk for a blood clot will go down dramatically. There are some other risk factors I'll mention really quickly. I mentioned the genetics and the cramped spaces or laying on a bed. Hormones and steroids, including birth control, as far as hormones go. If you take birth control, you could very well be at a heightened risk of a blood clot, so talk to your doctor about that if you're concerned. Also, pregnancy. My sister actually got a blood clot when she was pregnant a couple years ago. I mentioned smoking. Also, surgery. If you have a surgery, complications, you could have a blood clot afterwards. Also, cancer and diabetes. My brother, I have a big family. My brother was getting chemotherapy in his arm here. They had the chemo going in, and he got a blood clot in his arm, and so they had to take care of it and put a stent in his chest for his chemotherapy drugs. So, you know, be cognizant of that if you or somebody you know is going through chemotherapy. Next up, we've got trauma. You know, if, say you play soccer, someone kicks you in the knee, you could get a blood clot from it. So, you know, if you have an injury, just, you know, keep tabs on it. You know, if you have any sort of symptoms, definitely check it out. As mentioned, check out my other video, and I'll talk about blood clots, everything, prevention, signs. If you're interested in that, check it out. And of course, prevention. Final one, it's kind of a bonus. If you're like me, varicose veins run in your family, definitely talk to a doctor. See a specialist if possible. You can have a test to see if you're at it's a genetic test to see if you're at a heightened risk of blood clot. And, you know, you just have to be more careful, especially if you have varicose veins, you know. Varicose veins, you know, you have problems. I don't have good veins. You know, my blood pools to some degree. And, you know, when it pools, that's how you get a blood clot. And that's what happened. I just wasn't moving my legs. So if you're at a heightened risk, talk to a doctor. see what they propose, what you should do, especially if you work at a desk or if you're flying. As mentioned, when you click on the link below, healthcodeacademy.com/whatever, I haven't written the article yet, but it'll have all this information from this video as well as some additional. Also, I will have some product links for things such as compression stockings and which baby aspirin or aspirin you should use that's safe. And I'll even post a link to a safe water bottle or water container you can take on the airplane that will be large enough, for all your water needs. So I'm going to make another video more centered towards what happens once you have a blood clot, advice, how to deal with it. You can check the link below for that. I hope you use this information. If you have any questions, let me know. I've learned a ton in the past few weeks, and I'll learn even more, I'm sure. This is kind of, it's been so interesting. This is my health. This is everybody's health, but I've definitely taken it to heart. And like I said, if I can help people not get blood clots, that'd be awesome. And if you know somebody that's older that, is high risk, any of the things, just have them see this video. Like I said, if I can help people avoid a blood clot, especially while flying, which I could have totally avoided this, this video will be well worth it. So check the links below. You'll see the link to the other YouTube video, and I might post it as a link to my site because I'll have this in article form. And also, please like this video. Please like me on Facebook, Twitter, follow me, all the other sites. All that'll be listed below, healthcodeacademy.com. Subscribe to this channel and you can follow all the videos. Somebody's, I think, has a whistle or something. They're making my mind go all ADD. But definitely, please do all that below, and I look forward to keeping y'all healthy, happy, safe, productive, wonderful life. So thank you very much, and I'll see y'all soon. Have a great day.